I'm really excited to be here, and thank you for the opportunity. I'm hoping that what I can do today is build upon the great presentations that preceded me to build the demand for work in prevention and health equity, build the demand for holistic and whole person approaches to prevention efforts, and using data to drive decision-making to advance the work that we're trying to do across the state. We've been doing a lot of thinking around sustainable financing on a very local level in Sonoma County for the last couple of years. So I'm going to try to outline a little bit of our thinking, some of our lessons learned, some of the work that we're doing to test the concepts, and hopefully some of it will be applicable to areas around the state. First of all, why are we doing this? I think this is critically important to understanding how we're thinking about frameworks and models and ideas as they relate to a local level and relate to what we're trying to achieve in our communities. We know that there is a 10-year life expectancy gap between two places in Sonoma County just within 5 miles of one another. This sets up the why, the big why of why we're doing this work. We also know that the investments in health are not being directed in equal proportion to the determinants of health. So there's a mismatch between the money that's going into health care and the money that's going into social determinants of health. So imagine if we could create a system that invests in outcomes that are priorities for us, and also is able to assess whether or not we're successful and scale those successes. This is the big concept that we've been thinking about for the last couple of years. So we've built on a foundation of collective impact and collaboration that I think is also really critical to the success or ultimate, hopefully the success of this work moving forward. We have 2 major collective impact efforts in Sonoma County that have been building work around strategy for about 10 years. Health Action is our effort to leverage local leadership, cross-sector organizations and agencies, community and resident engagement in thinking about what our critical needs are in our community, what the data tell us about our needs, determine priorities, shared outcomes for our community, and then some strategies around addressing those priorities outcomes. Upstream Investments is a collaborative partner, parallel collective impact effort that focuses on how we address those strategies. So the focus there is around evidence-informed interventions, prevention-focused investments, and building capacity on a local level to make sure that we are able to meet outcomes. So these efforts have been harnessing collective power for the last 10 years or so, taking a very explicit approach to thinking about data on a local level that tells us where our health disparities lie, both in terms of place and population on a local level. So with that, these efforts have really taken an explicit health equity lens to the work that we're doing to advance prevention in Sonoma County. Furthering that effort, we produced a report a couple of years ago in 2014 called The Portrait of Sonoma County. There's a portrait of Marin, a portrait of California as well. And this looks at well-being in our community from the lens of human development. So rather than ask how are we doing in terms of progress and prosperity and economic drivers, we're asking how are people doing in our community? What choices are we afforded to live long and healthy lives? So the report documents on a local level data using the Human Development Index down to a census tract level and measures social determinants of health. We have data on access to long and healthy lives, so life expectancy data. We have data on access to knowledge or educational attainment and data on access to a decent standard of living, so economic data. And what we learned from this report, probably not surprising, is that in our community, a resident of one neighborhood, East Bennett Valley, can expect to live about 5 years longer. It's almost 7 times as likely to earn a bachelor's degree. It's twice as likely to own their own home, and earns over $47,000 more than a resident of Roseland Creek, just a few miles away. So this equity lens has been really important for us to think about place-based strategies and investments to decrease the disparities and look at the inequities behind them in our community. So as we've been developing strategies over the last number of years, we came to the point where we had to ask ourselves the question, if we're developing strategies, how are we going to pay for them? I mean, it seems kind of obvious, but we literally came to that moment, and which launched a whole lot of work in the last couple of years. So first we did a sort of landscape scan, a current view analysis of what's going on in terms of funding in our community. And this is just one snapshot, and there's a lot more involved in this, but essentially we found that there's not a lot of prevention funding, or it's not directly being aligned to outcomes, particularly in the areas of social determinants of health. There's a reliance on short-term funding mechanisms, typically grants, some government contracts. Oftentimes we're chasing grants, and the grants are determining the programs rather than the other way around, which would be ideal. Also obvious, but that is the case. And that there's limited outcome evaluation, so we're not entirely sure whether or not we're making impact with these smaller investments. So we concluded from this that we really needed to take a longer-term approach to our thinking about financing and funding in our community. It was not going to be achieved by one organization, so we really needed to harness the collective impact approach that we've been doing on the strategy side, also in the funding side, and that the current allocations that we have are simply not sufficient to make the type of impact that we want to make. So we started with some big questions. How can we create a system and test that system that will support outcomes that we want to achieve, that coordinates, that focuses on the long-term impact that we want to achieve, and is sustainable? So this is the work that we've done over the last number of years. We started with forming a team. This is a cross-sector group that we named the Sustainable Financing Catalyst Team, literally to catalyze ideas and test and prototype these concepts so that we could see what works and what could work in our community. So this committee, which started as an ad hoc, just a small group of people just doing some thinking, we started with the basics. We started by defining what does sustainable mean to us. We focused on thinking about diverse and reliable sources of funding, and we thought about the ways that this is not like business as usual. And that was really important to us to think, how can we make this model or the work that we want to do different from the way that we're currently doing our funding, and be really explicit and direct about that intention. We launched a pooled fund, a pooled wellness fund in Sonoma County. I'll talk a little bit about that. And then we continued to build the demand for further analysis. So as we launched the pooled fund, we did two simultaneous analyses. One, we did a landscape scan of similar wellness funds around the country. Some were mentioned in a presentation earlier this morning. And we learned lessons learned, what was going well, what we wanted to take and apply locally, what didn't really work for us. And then we did some local research to assess what our local needs are and how we would apply some of these concepts locally. So in terms of the landscape scan and what's going on around the country, we got some great research and learned a number of things from these efforts. First of all, there seems to be a greater interest in paying for outcomes rather than outputs. And that's something to be leveraged, and that's something to be messaged around. Next, that there are new investors, whether they're impact private investors or foundations that are interested in this type of work, and they're looking for new ways of financing to achieve impact. So those are great opportunities for us to try to leverage. Challenges, many of these funds are actually too new to see whether or not they're sustainable or not. So this is a new field, all of this is a new field, and so thinking through how we test and evaluate the impact of these methods is going to be really important. Most of the funds have one-time limited funding going into the funds and are doing grant making out of the funds, not testing necessarily where the savings are accruing and reinvesting back into those funds. So this capture and reinvest sustainability model has not been fully tested yet in these funds. So there are some opportunities for furthering the field by testing these models. In our local analysis, we interestingly came to the conclusion that we needed more than just one fund, that there were more needs in our community to achieve and sustain impact than one fund might be able to achieve on its own. Broadly, we came to the conclusion that we needed funding for backbone support, so communications, community engagement, evaluation, cost-benefit analysis. We needed funds for research and development, testing and iterative processes to see what works and to scale what works. And then the innovative financing, these are the bigger investments that we're imagining that would go towards specific outcomes and be able to scale what works. So we've tested these ideas in a couple of different feasibility analyses. First, we were engaged for about a year in a feasibility analysis for pay-for-success financing with support from the Social Innovation Fund and the Institute for Child Success. And we tested 2 interventions, nurse-family partnership and access to high-quality preschool for this feasibility analysis, and concluded, we concluded that preschool was feasible for pay-for-success financing. But the bigger picture conclusion from this feasibility analysis is that there are investors out there that are really interested in paying for outcomes. And this is potential new capital for us to tap into. We have to have mechanisms in place to document and evaluate whether those outcomes are being achieved so that the payments kick in. And those investors are not only interested in the social return, but also interested in some financial return. So the outcomes and evaluating the outcomes becomes critically important. We've also done a feasibility analysis on capture and reinvest financing. And so the idea here is that if we're investing in some sort of prevention efforts, that savings and or benefit may be accruing to different systems. And if we can identify where those savings are accruing or benefits are accruing, monetize them, value them, and negotiate for some of those savings to be reinvested back into the program or back into even further upstream efforts down the road, then we have a mechanism for sustainability. So we've been doing a pilot test on this and are just now doing the cost benefit to value the savings that are accruing both to our local hospital systems and also the health plan as a result of an intervention in a respite care pilot. This is what Larry mentioned earlier as the closing the loop feedback model, right? So you have your investing in evidence-informed interventions, measuring the outcomes and the impact and the savings that are accruing and negotiating for some of those savings to go back into whether it's a pooled fund, the program, or an upstream investment. Depends on the type of investments and the savings that are being accrued and the value and the interest of the parties that are doing the negotiation. But we're trying to test this model. And what we've learned from this is that data is really important. This underscores the last presentation of really getting to a point where we can understand on a timely basis what we're learning in our communities and what the data tell us. So from this, we know that data availability often will influence which payers can be involved, that cost data is particularly difficult to obtain. And then also on the flip side, that the service providers, those that are actually delivering the services, have to have mechanisms in place to evaluate their outcomes. So we can show program fidelity and also evaluate whether or not those outcomes are generating the savings. So finally, we've put together what we think is a sort of comprehensive model through what we're calling the sustainable financing analysis. And this it has allowed us to walk through what the steps are in order to get to a place where we're actually testing a sustainable financing model locally. So I'm going to talk through the model itself, which looks like this, and then give a couple of examples of how we're trying to test that model through some pilot projects. All right, so first, we start with what the outcome is. What outcome do we want to affect? What's the critical need in our community? Where's the community readiness? That's the starting point for all of these efforts. And then we have to think about which interventions do we know are actually going to affect those outcomes. From there, how can we most effectively impact the desired outcomes? Now here, we take the landscape of everything that could potentially affect an outcome and run it through the spectrum of prevention, right? We think about the multiple ways that we can affect an outcome, whether it's policy, programs, campaigns in our communities, and put together a portfolio of interventions that are evidence-informed and that we think will meet an outcome. This first screen, before we even get to the funding piece, is really, really important so that we're not allowing the funding to drive the programs, right? So we wanted to include this in here, particularly for our community as we message around this, that the funding is not the one that's driving this. The funding is supporting our attempt to get to the outcomes and our understanding of what we think will get us to those outcomes. Which then brings us to the screen 2, which is how can we most effectively fund that portfolio of interventions? And we start with what funding sources do we have or could we potentially garner for this work? So we know we have existing prevention funds. These are existing grants in our communities, existing government contracts that we can begin to align toward the outcomes. We have the potential to garner new private funds, philanthropic, private capital, potentially redirect new public funds. We heard about the waiver program, so certain programs that allow some flexibility to redirect public funds, and cashable savings that we can capture from systems that may be accruing those savings. Then, this was also important in our discussions, do we actually need to touch those funds? And in many cases, we don't need to touch those funds. In many cases, we don't want to build out a model and test it that becomes too bureaucratic to have impact. So this concept of aligning funds, existing funds, toward outcomes, and creating the ways that our funders in our local community can direct their investments toward those outcomes is equally important as the ways that we could try to pool funds and bring in new funds and pool them toward priority outcomes. Then finally, how are we going to use these funds? There are a number of ways, and I've touched on most of these. One, large interventions, those that are not traditionally funded. This was of particular interest at the beginning of our conversations when we realized we just don't have enough funds to support the outcomes that we want to achieve. Secondly, research and development and capacity building. We need to have an iterative approach to be able to prototype. Rapid prototyping is really critical, especially at the beginning of the field growing. Backbone support, being able to evaluate our outcomes, support the community in achieving those outcomes, community engagement, policy development, all of that. And then the smaller interventions, those that are traditionally funded, but yet again, being more sophisticated about how we're aligning those funds. In terms of the large interventions, we wanted to prioritize both the outcomes and the potential impact and also the opportunities to potentially generate cashflow savings, because this is the opportunity to go back and have that feedback loop back into the system. Again, whether back into the pooled fund or back into the programs or upstream investments, that would have to be negotiated. But prioritizing our opportunity to assess whether or not there's cashflow savings seemed pretty important to us. So that is the conceptual model that we have developed over the course of the pilot tests that we've done, the feasibility analyses, and then just our collective thinking on a local level, trying to apply some of the concepts that were presented earlier to what might work in our community. And then we've been testing it. So I have two examples of how we've been trying to test this model and run our programs or projects through this model. One is our Accountable Communities for Health pilot project. So this is funded by the California Accountable Communities for Health Initiative, CACHI. And we're one of 6 communities that have gotten this grant. We're focusing on cardiovascular disease to test this model. It's outcome driven. We have a collective set of partners trying to connect clinical practices with community practices. And right now we're at the point of developing our portfolio of interventions. So that work is meant to build out the broad array of community and community clinical interventions and policy interventions that we think will affect cardiovascular disease. One of the components of this grant is that we establish a wellness fund. So we have already established a wellness fund, but now we're trying to test it in relation to the Accountable Communities for Health model and grant opportunity. The other one is a new initiative that is just being launched right now, and it's involving the government departments and community partners that essentially are involved in safety net services. So we have 6 government agencies that are involved in this, our hospital partners, clinic partners, and we're focusing on high-need residents and coordination across these various systems to be able to identify shared clients of these various systems and connect our data systems and integrate those data systems to be able to provide a more integrated referral system and outcomes-driven evaluation system. So the idea here really at the end of the day is for government improvements, government performance improvements. So that's just getting off the ground right now, and the idea long-term is to assess the impact of this coordination of data systems across our community to assess opportunities for more efficient ways of using and directing our resources. So, like I said, a couple years ago, we had this set of questions that came up that we've been testing over the course of the last couple of years. We have a new set of questions. This has been an enormous learning opportunity for us, and I think we want to continue that work. Questions around how do we support strong stewardship and communication related to this work? Now, these are complex topics, and they're really hard to communicate around, and that has been super clear for the last 2 years. And so the opportunity to be able to come here today and communicate about the work that we're doing and communicate with our local partners has been a constant challenge and opportunity. How do we deal with potential contributions to efforts that are not aligned with the priority outcomes? That's a big question for us that we haven't confronted yet, but certainly is there. How do we deal with the fact that when money gets involved, everyone wants to get involved for various reasons, and addressing that question? And then what level of data is needed to actually prove outcomes? If we get so bogged down in proving outcomes, we may limit the opportunities to invest in things that are working and scale those successes and just get caught up in the evaluation piece of it. So next steps, building on what Larry mentioned earlier, we're testing this idea of cashable savings on a very short return cycle. But the real win will be when we can monetize and assess benefit and social return on investment for the long term. So we can engage the education system, so we can engage the criminal justice system, our economic development systems in reinvesting and investing in health and prevention. So thinking about the value and communicating that value, monetizing that value for those systems is ultimately the direction we want to go. We want to attract new capital, scaling what works, and institutionalize those funding mechanisms, and then also apply the same type of thinking to our government performance, both in terms of policy development to institutionalize some of these changes, and then also institutionalize our investment mechanisms so that we're paying for outcomes. Finally, I just wanted to leave everyone with why we're doing this work, because I've talked a lot about systems and models and concepts that we're testing, but ultimately we're doing this because we want to close the 10-year life expectancy gap that exists in our community and exists throughout the state. So thank you for the opportunity to be here today.